went through Cornell, then moved to Rochester. Now, did you Rochester School of Medicine and Dentistry and Biopsychosocial? I don't know what that is. Tell me more about that. What is biopsychosocial?
So the biopsychosocial model was invented at the University of Rochester, right? It's basically saying, how do you look at someone's health with all these lenses, right? Your biology, your psychology, and the social aspect, right? And so how do you take health and not just look at it as a disease process, but how it affects the way someone thinks and how it affects the way they work in society or behave in society, right? And so it's really kind of taking that whole thing. And so Rochester, so back to that biology professor, she was the one who wanted me to apply to Rochester, right? And so she was like, you need to apply there. I think that's a great fit for you. And so that's kind of how that whole thing happened. And so once again, right, so like, when you talk about like divine interventions or whatever, like that was, it just kind of happened the way it did. And in Rochester, I learned a lot when it comes to like, we had to take medical humanities, we had to take, art and medicine, we had to go to, we'd go to museums and you look at, paintings and you talk about, well, what feeling do you get, right? And so those are those same skills. And you say, well, what relevance does that have to a doctor? Well, same thing, right? When you enter a room, patient room, or in the hospital, who's around, who's talking, who's not talking, who's silent, what emotions do they have? And so it helps you pay attention to the things that are not said. And I think that's what medicine has been missing when you purely look at it from the scientific lens, right? And so when I talk to patients too today, I pay attention to, their speed of their talking, their what are they telling me? What are they not telling me? And what the order that they're telling me? And so these are all things I think Rochester did a fantastic job of teaching us.